大家好，我是 Karen， 今年40岁，来自 KL 锦江，有一个小孩子。在之前呢，我的月经是一路来是很准时的，所以在7月份的时候呢，我就开始来月经，来了到9月的时候，完全是不能停。
The patient came to see me in my gynae clinic because of dysfunctional uterine bleeding. What do you mean by dysfunctional uterine bleeding? Means she has irregular cycle, heavy bleeding, in medical term we say menorrhagia, with large clots.
它影响到我太多了，晚上不能睡啦，腰骨痛啦，是整个人很不舒服的，胃口方面就很差。去见 Dr Thangesweran 的时候 ，Dr Thangesweran 跟我讲坏消息，他讲因为你是去到 pre-cancer 了，所以一定要切除那个子宫。如果我不切除，一定会有那个 cancer 在我的子宫。然后我就接受了。
Because of this condition, where she had dysfunctional uterine bleeding, I performed hysteroscopy and endometrial biopsy. Endometrial biopsy histologically revealed that she has what we call precancerous of the lining of the womb. In other terms, we call them as atypical endometrial hyperplasia. So this is the precancerous stage, and this can lead to endometrial cancer. As a responsible consultant and looking after her BMI, I have recommended her to undergo Da Vinci robotic system surgery, which involves taking her cervix, the uterus, the tubes with conservation of ovaries. Robotic surgery is quite useful for complex cases. So the complex cases can be divided into two categories. Most common, we tend to say complex cases such as past open surgery, like for example a midline surgery or transverse incision. But also the patient BMI also is considered as a complex. Such a high BMI patient, just imagine she has so much of layers to go through if you do a midline incision or transverse incision with the background of glucose intolerance leading to a pre-diabetic condition. Just imagine the healing process, wound breakdown, wound infection. All these are high risk for open surgery. The robotic system with the Da Vinci, you have a special long trocar for the high BMI patient, and more importantly, the robotic surgical instruments are so flexible, it can access each and every quadrant with all the degrees that the robot instrument has to move right, left, up and down. That helps us to do. And more importantly, with the fourth arm, you can manipulate the uterus, you can push the omentum. So all these extra advantage you have on the robotic Da Vinci system, which will help you to do the surgery safely with the high BMI patient.
他有跟我讲，因为我的 BMI 是很高的 ，robotic 的风险减到就是最低的，然后我就选择 robotic。它帮助我恢复得很快，做手术是要2-3个月恢复的啦，我只需要3个星期罢了。第4个星期我就可以到处跑了，我不用讲一定要有人载我了，我可以自己驾车，我可以走。
So, robotic surgery is a keyhole surgery. Robotic surgery is different from the standard surgery because it uses a high-end technology. The vision is amazing. That's what makes the whole surgery is, safe. It is an elegant surgery. That's what I would describe.
这边的设备很好，很齐全，然后护士全部都很细心的照顾我啦。然后 doctor 呢很细心，在这段日子很难熬的时间，他帮助我很多，照顾到我康复为止啦。我很感恩 Dr Thangesweran， 谢谢你。
Since the operation, I was keeping an eye on her because of the high BMI. Next day morning, I went to see the patient. After the surgery, she was walking, and she said, "Thanges, I don't have that much of pain, just mild discomfort." So that is what a robotic surgery with 8mm incision can give to a high BMI patient. 2 days later, she went home. 2 weeks later, she was up and about like a normal person. So This is the benefit that she had. More importantly, she had management, pain management with the paracetamol. I did not give her any morphine infusion. She recovered so quickly, 2 weeks back to work. She had no risk for blood transfusion. She had good pain management with the simple paracetamol, and she was up and about immediately. So that was the basic major advantage of going through robotic surgery.
遇见跟我同样的经历，一定要马上去看医生，不要再等。我会建议他们尽快看医生，然后我会介绍Dr Thangesweran给他。
So what I would advise always to any high BMI patient, please reduce your weight, and then as a responsible consultant, whoever it is will choose the best surgical method, the safest surgical method to deal with your gynecological problem.